All right, Dr. Emer, we are live.
Hey guys, come on in. I want to show you my beautiful patient. So I have my gorgeous patient here today, and she's doing, we're getting really up close and personal today.
You said get up close.
We're doing some female facial sculpting, and this is a really good one to discuss because we're not doing anything dramatic. She already looks really good, but she has a job that's very high stress. She's always working, just like me, barely sleeping. And so she's noticed a little sort of volume loss, a little sagging to the face over this past year. Everybody's had that. I call it the COVID descent. So with that said, you guys, what are we going to do for her? We're going to use a little lip filler to volumize her lip and slightly around the mouth. And then I'm going to use Sculptra. We don't talk about Sculptra a lot on social. It's an injectable that's a biostimulator. I call this the fertilizer to your lawn. You inject it, it builds collagen. So what are we going to do for her? Just the central and lateral cheek, temple area, slight bit right here in the pre-gel sulcus. Some people call this the marionette area, because look, when we squeeze here, just a little bit of volume loss, a little bit of shadowing, which of course I can use a little filler, I probably will, but the Sculptra is going to build the volume here in this bony structure, and then a little bit back into the back of the jawline. And all of that contours the face, it builds collagen, takes about 6 to 12 weeks to see it, it lasts for 2 to 3 years, and allows us to get an overall nice volumization of lip without her looking like anything was done. You know, my without a trace lip, we want to do things without a trace. So ice your lips, we're going to start with your lips. Her lips are already great, you guys, so what are we going to do today? We're going to use Restylane Refyne. This is one of our softer, fine line, hydration. This is like the chapstick of filler, okay? This is just going to soften her lips. Okay, go ahead and take them out. Look, she already looks great. I'm going to start a little bit on the lower, just to give her a little bit of volume, very minimal. I'm going to do some fillers. This is a very soft filler. You don't need to use a lot for it to refine, which is why it's called Refyne, because you're not defining, you're refining. There's another product called Define that allows you to build structure, like the cheek and the chin areas. This is the finessing filler, okay? This is the one that we just want to make it softer, brighter, just make her look amazing, balance out her personality. And you see, it's just hydrated. Ice again for a sec. It's just hydrated. Now tell me if they're saying anything, okay? Don't leave me out of the loop.
People love it. People are giving us heart eyes. Some of us thumbs up. People are waving.
Thank you guys. Now remember, I take all injections seriously. I've been doing this for 15 years. And the one thing, go ahead and let go, about even though we make it very socially available, it definitely has risks. So it's one of those things where you want to go to an expert and you want to make sure that you go to someone you trust, you know, and we're building this slowly because we want her to continue to look good long term. My clients go to me for years and years. So look, we're already, look at that little bit, only about a quarter to half of a syringe. And look at the lift already. Look at the softening there and the volume. Now again, the shadowing that's here, by improving this, will bring the lip down a little. You see when I go like this, you see how the lip moves? That's what the Sculptra is going to do.
Dr. Emer, what's the difference between Sculptra and Juvederm?
Well, remember you guys, I just said, Sculptra is a biostimulator. It's not an actual filler. It builds volume over time. So what we see today is not what Sculptra is going to be. This right now is not the Sculptra. This is the Refyne. And I'm going to use a little pillar technique here, very superficial. And just soft. I just want to get this little cupid's bow to come up. Look at that. Look at that little bit right there, you guys. Look how cute the central part of her lip already. From that just a small bit. With her, we really want to focus on keeping the lip centralized and not widening it too much, because her lip naturally has this very triangular shape. I'm also going to give her just a little bit of a...
I got a question for our patient. How bad does it hurt?
It's for you. They want to know.
Does it hurt?
They want to know if I'm torturing you or not. She's a strong woman. She's very strong. So look at that already. Look at the upper, look at the bottom. It's very balanced and beautiful. I'm going to do that same thing over here in this side. I'm just going to do a slight bit. I use a little pinch technique to just keep it where I want it to go, creating the shape that I want. And now we're going to go more superficially And remember, you guys, we're customizing. We're customizing. Oh my God. This is so good. She needed this filler, guys. It's like being in the desert without water. You need it. When you get it, you realize how important that water was. Okay, ice again. So I've only used about 2/3 of the syringe, and I already have a really nice improvement. So one of the things I'm going to do right now, I'm going to take a look, let her ice, so the swelling goes down, because I don't want her to lose that 20% and be unhappy. Okay, go ahead and take that down. Oh my God.
Dr. Emer, do Botox injections cause difficulty during swallowing?
They should not do that, although I will say in the package insert, it does say that that's a possibility or something called distant spread. But no, it should not do that if it's done well. Okay, you guys, again, we're refining. Okay, that's the name of this filler. But really what matters, you guys, is not the filler, it's who's doing the filler. That's the key. Okay. I also want to give her just a little bit extra, this upper right here. I'm trying to lift this a little bit. I don't want her to look overdone, you guys. To me,
People are saying she looks beautiful.
she is beautiful. So we're going to do just a fine bit here in some pillars, very superficially, because this is going to support those shadows like I was telling you guys. With Refyne, we can go nice and superficial. Some people even like to see the white of the needle, is what they say. And this is going to soften. This is called the lower cutaneous lip. Look right there now, and look right here. It's very subtle, but it makes such a difference in the overall look of the face when everything is blended in 3 dimensions. Okay, that's going to make the lip corners go up. That's going to up the lip corners, okay?
Doctor, how long does Botox in the crow's feet last?
2 to 3 months, guys. You know, Botox only lasts a few months. That's why we do plasma pen and other lasers to give a nice improvement.
Someone's asking, how long will this last?
This will last for about 9 months to a year. Although I feel like all my girls, once they see their lips in a couple weeks, they always want more. Everyone always wants a little more. All right, let me show her, before I do the Sculptra, let me show her her lips, because the Sculptra makes you get a little more swollen. Take a look at those beautiful lips. What do you think? That's a good sign. That's like going to a restaurant
She's happy.
and having one of those first bites. You know what I mean? So a little more volume here. I softened here so it balances your beautiful chin. And then just that perfect Cupid's bow with lift. Obviously it's a little swollen right now, but look at the overall look of the shape. It's more volumized and it looks super natural. You love it. Okay, good. Now, success. Now she ices so she doesn't get too swollen. Now we're going to do Sculptra. And I always tell
You had a good job, Dr. Emer.
Thank you. I better be doing a good job.
You better be.
A long time. So now I'm going to tell people, this is what I call the snow globe. So if you take a look, and here's our snow globe. This is Sculptra particles. This is called PLLA, or polyl-lactic acid. This is an injectable. We're going to use this kind of pan facial. We're going to first focus on temple. It's going to feel really weird. Some people will do what's called an aspiration, just to make sure there's no blood. And then I always tell people, because there's numbing in here, it's going to feel a little weird around the eyes and around on the jaw today. And you may feel a little pain when you chew tomorrow.
How do you know if you're getting a genuine Botox injection? What should I be looking for?
Go to a really good doctor.
Like
Any
you.
good doctor would never substitute what they're giving you. Now her face is a little more angled here, and I want to keep it that way. So I'm going to use the Sculptra to the deep medial fat pad, and then also to the submalar fat pads to get more lifting. She's going to look a little larger today. And then again, remember I told you I'm going to use Sculptra pan facially in the back of her jaw to give her some lifting and shaping, because that's going to pull everything back. And we all know as women and men that want chiseled features, we want to keep the skin tight. The other thing I want to do for her, and this is what I don't always do this, but this region here, I call this the lower triangle. We need to do a little bit of sculpture here because she has noticed herself from work and stress and stuff that she's noticing a little bit of volume loss. So I'm gonna go right on bone down here in the chin. I also did right here in the submalar sort of lower triangle some volume. So if you take a look at the one side, it's gonna look bigger, it's gonna look higher, it's gonna look more filled, it's gonna look angled, and we're gonna have support here in the marionette area as well as here. All that swelling is gonna go down in the next day, and then it's gonna build up over 6 to 12 weeks. Okay, let's switch sides.
People are asking, is this expensive? Can we give them an estimated price, or should they contact us?
I mean, in general, you guys, sculpt vials of aesthetic treatments can be between $500 and $1,500 a syringe. So we're doing a couple syringes today for her. So, but again, this is investing in your overall look and how you look and feel. And again, you want to go to an expert. So here we are, we're injecting the Sculptra onto the bone of the temple. This is also going to lift her brow, just going to make her look more awake. It's going to balance her face, and it's going to help just overall volume. Love your lips.
Someone's asking where are we located. We are located in West Hollywood, right off of Sunset.
West Hollywood, California. They might be from another country.
We are in California.
States. And then also, you guys, go to appointments@jasonemermd.com if you want to make appointments. So here's the thing. Sculptra is very important that you know what you're doing because you can change someone's facial features. We're going to the deep medial fat pads, okay? And we're going to the submalar region. Remember I told you this lower triangle. We're going to do some deeper injections here to give some overall volume, and collagen production is going to help her mouth as well. Sculptra is not the most pretty treatment. It's a lot of needle pokes and then some bleeding, but she's doing great. Hold right here for me for 1
Is
second.
Botox helpful
No, you're
for
good, you're good.
migraines?
Yes, it can. Botox can be used for migraines. I even use it for muscle spasm, for muscle spasm and trigger points, you guys. All right, now lastly, we're gonna do, again, like I said, a little to this jawline, just to get some lifting to the back. It's gonna give her an overall balanced look. A little to her folds.
Someone said, lucky girl, you are in the hands of a genius.
I don't know about a genius, but I would say maybe an artist. I love what I do. And I love just taking care of my clients. So again, I'm doing a little bit of that. I'm seeding that lower area. And you don't want to do too much to the cheek area because I don't want to change her facial features. But now, let's take a look at her. Overall, she's going to look a little more swollen. But let's point out what we did. This is what I call volumetric filling or structural building. So midface lifting, the definition of her jawline and midface, temple hollowing improvement, building out of the chin and the piriform. And then we used filler like Refyne. So now look, she doesn't look different. She looks better. The Sculptra is going to settle in, and it's just going to bloom. She's just going to bloom. Like over the next couple months, she's going to look so good. And the thing about Sculptra, some people say that you have a Sculptra glow after about a couple weeks because the Sculptra is stimulating collagen. It's like fertilizer, like plants. Plants grow. So let's show her face even swollen so she can see. I know it's going to be a little swollen from the Sculptra, but what do you think overall in terms of just like volume and lifting now? There's a little bit of bruising, but more lifted, more filled out, more tightening. All this will settle. This will pull back. This will come forward, and now we have the beautiful lips.
How long will her Sculptra last?
So remember, a Sculptra lasts about it starts activating in 6 to 12 weeks and lasts for 2 to 3 years. So for her, we'll probably do 2 treatments in 6 months, and then we'll be set for a year or 2. All right, you guys. So take a little pan, show a little pan of her face, and that's female facial sculpting. So pretty. Perfect. So we will, pan and show them, and that's it. All right, you guys. Thanks for tuning in. Bye. So what I have pictures, take your pictures, and I think that'll come in the evening.
Oh my gosh, I'm obsessed. It looks so good.